Hi, my name's Jams. I'm the marketing assistant for the dental architect here, and I'm here to ask Dr. Martina some probing questions about turkey teeth, getting your teeth done abroad versus getting your teeth done here in the UK or whatever country you live in. So, Dr. Martina, why would you say that people go abroad to get their teeth done rather than staying in the UK?
Yeah, so I think it can be really tempting to people to want to go abroad and get their teeth done because cosmetic dentistry in the UK is really expensive, right? And you see all these adverts and hear of people going abroad and getting like full mouth veneers or crowns done for like a few grand, plus you get a free holiday thrown in. So it can be really, really tempting. And I think, if you're on a budget but you don't like your smile and you're looking to improve it, then yeah, free holiday thrown in with a great new smile
makes sense.
Can look really, really tempting.
So, what would you say are the most common procedures that people go abroad for?
Yeah, I think people go abroad a lot for like crowns and veneers because obviously they can be pretty expensive. And I think people want like a quick fix. So things like Invisalign and teeth straightening, although it's so much less invasive, it takes time, right? And people are like, I want it now. But also people go abroad for implants as well, because obviously the price for implants in the UK can range from anything for about £2,500 per implant. And if you've got missing teeth, it makes you lacking confidence. If you have problems eating and chewing, spending kind of tens of thousands of pounds on full mouth implants it's just not possible for a lot of people in the UK.
Of course. So going on from that, would you say that a lot of people with the state of the mouth, with the state of the oral health, they are affected in their mental health and their self-confidence a lot, and that you think is a deciding factor to go abroad?
100%. I see so many people who come in on a daily basis who won't smile on camera, who won't even go to restaurants because they can't eat a steak, who won't go out and be on wedding photos and stuff. And when you transform their oral health and you give them a beautiful smile, it doesn't just change their teeth, it changes their whole demeanour. You can see it changes their confidence. You can see that person just smiles from the eyes. It is amazing to see, and I can see why so many people, if it's affecting your self-esteem, it can just seem like, you get to that point where you're desperate, you can't afford it, and going abroad seems the easy way out. But as we know, there's a big downside to that.
So what would you say are some of those downsides to going abroad?
Yeah, I think, there's thousands of amazing dentists out there abroad, and, I absolutely don't want to tarnish them all with the same brush. But at the same time, there is a lot of dentists out there in some countries that are not putting their patients' best interest first. And they are putting their bank balance first. And, it's so saddening to see what is happening to young people's teeth who have got beautiful teeth, and they're going abroad and they think they're having veneers, but veneers are very superficial porcelain kind of shells that we place on the front of people's teeth, which do require very minimal tooth preparation. And what they're in fact coming back with is a mouthful of stumps. And they are coming back with a mouthful of crowns, and that is a very different thing. And they are getting perfectly healthy teeth cut down to tiny pegs so that they get in this look that they want, straight white teeth. Now, that is one way to do it, but what they don't understand is that they weren't having veneers, they were having crowns. They don't understand the long-term effects that that's gonna have on their teeth. In 5 years' time, a lot of those teeth are going to die. They're going to need root canal treatment. They're going to get abscesses. They're going to be in pain. I see people coming back who can't bite together properly and are excruciating pain in their jaw joint. And the problem is with this is dangerous. This is seriously dangerous stuff, because they're coming back and they're having all these sorts of issues. And what was once a simple thing to fix, non-invasively and ethically, has now become a monster of a problem. And the problem with that is, what are you going to do when you're faced with those issues? Are you going to go back abroad to Turkey or wherever? Because what you will find is in the UK, you will then struggle to find a dentist who has got the skill set to deal with such a complexity that has now been created by this situation. You're going to be faced with bills of tens of thousands of pounds to correct it, and lots of misery in the meantime. And you'll be faced with dentists who honestly don't want to touch you because they don't want to start involved in this situation where everything's a mess and then their name is involved in it, because it wasn't their mess to start with. And you know what? You can't blame dentists for not wanting to get involved. It's not out of spite. It's out of, where do you start with these issues that were once simple, now horrendously complex issues to deal with?
Perfect. So going on from that, just bringing it back to what you were saying a second ago, why do you think it is cheaper to go abroad to get these cosmetic implant stuff?
I mean, I think that's the big pull, isn't it, for people, is the price.
Yeah.
And that quick fix, and it can be a lot cheaper abroad. And the reason is in the UK, we're fully regulated.
Yeah.
We're fully indemnified. The cost of materials, of quality lab materials, quality implants, quality porcelain, is all a lot higher. And then just the general running costs of the clinic, we like to pay our team well, and all these kind of things. The cost of it all is just that more expensive.
Yeah.
And I think, yes, there is this perception that dentists are money grabbing, and they, a lot of people understandably look at the prices abroad compared to the prices of the UK and think that it's because dentists are money grabbing. But it is, the difference is that, in the UK, us as dentists, we are kind of brought up on this ethos of do no harm,
these ethical values.
Ethical dentistry. Now, to me, I don't know what you think, but drilling 32 teeth down to tiny pegs that are all completely healthy teeth, that is not ethical dentistry to me. That is not doing no harm to your patient, and that is not acting in the best interests of your patient. And a good dentist, just the same as a good doctor or a good facial esthetician, will say no to patients.
Yeah.
And I had a patient come through on the DMs the other day, and she wanted her front two teeth cutting right down. And she's like, I can't find a dentist who'll do it. And I'm like, good, because there's other ways than just cutting perfectly healthy teeth down.
I think it's important to say as well that we don't blame these people for wanting to come to us with these procedures. That's just because they've been misinformed about what's best for them and their health and what they think they should be happening, which is kind of why we started this channel.
Yeah, it's about education. It's about, there's other ways. And if you go to a clinic abroad and the only option that's discussed with you is 32 crowns,
red flag. Red
sign
flag.
here, and you're not given full consent and you're not making an informed decision on the risks of it, that's where the problem lies. So if you want to go abroad, do your research, find out, speak to your dentist. A good dentist is going to tell you the pros and cons of every procedure, but also give you the alternatives as well. And that's, you present with your problem, you present with your issue, and what it is that you don't like about your smile. And there might be 5 different options in terms of treating that and giving you a really similar outcome, but in a much, much less invasive way. And keep a set of teeth that's going to last you the rest of your life. Because when you go down that route of cutting them down to pegs, that's it, you've gone down that road, there's no going back.
Okay, so finally, what would you say, or what advice would you give to somebody that came to you and was looking at going abroad? What would you say to them?
Yeah, I think really it's just about do your research, find a good clinic, find a clinic where you can check that dentist's qualifications. Do your research on the treatments that are available to fix your problem. Don't just think that there's one solution to your problem, and just do your research. And at the end of the day, if you're confident that you've found a good dentist and a good clinic and you're going to get good quality work and it's not going to cause you long-term health issues, go for it. But that's the decision that you make. And as long as you're making an informed decision, that's all I care about.
Okay, Dr. Martina, thank you. We got very passionate on that, but it's good. I'm glad people love to hear that kind of stuff. But yeah, thank you for your time, and thank you to everyone that's watched the video. We'll be back again with another video very soon. But in the meantime, if you've liked the content that we've been putting out recently, especially today, We want you to like, comment and subscribe and ring that bell so you can get notified on any future videos coming from the channel. So thank you everyone, see you later.